Threefold woman, unicorn, the lady, and lover, and Lord. Some persons are quick to think of surgery as the only treatment option. Can you explain what treatments involved for you? What are the treatment options for uterine fibroids?
So there are medical treatment options that are available for patients with uterine fibroids. And the thing that we look at when we're coming up with a treatment plan, we want to again take the whole patient into context, right? So we look at the age of the patient, right? What are the patient's reproductive desires? Like, so is this a patient who is desirous of future fertility? And even if she is not, is the patient fit enough for surgery if surgery is an option? So everything has to be looked at in totality when coming up with a management plan. But in terms of medical management for these patients, we can look at things such as your non-steroidals to help with the bleeding if anemia is one of the symptoms that the patients may be having. So look at things that can help to decrease her loss each month. So try to allow her to have somewhat of a normal menstrual cycle. And we can also use what we call GnRH analogs. It's an injection that women would get either monthly or every 3 months. And these GnRH analogs would help to shrink the size of the uterine fibroids. Okay. The other option is using interventional radiology that they can have a uterine artery embolization. So you're cutting off the blood supply to the fibroids so that she does not require surgery.
Okay. So it's good to know that surgery is not the only option.
No.
Yeah, that's so good. So can you briefly provide some insights into fibroids and pregnancy? Because you mentioned that women typically in the reproductive years are also a part of the large population of women that are affected by uterine fibroids.
So in terms of fibroids in pregnancy, so some of the things that can happen is that the fibroids can undergo what we call a degeneration. So they start to die somewhat as a result of their loss of their blood supply. This happens during pregnancy, then she would probably have quite a number of visits to the accident emergency or the maternity unit for these pains that she may be experiencing. So, the physicians would have to make sure that she has adequate pain relief that would be safe during pregnancy. So that is one of the things that can happen as a result of pregnancy. Another thing that can happen in pregnancy is that, she would obviously have a larger abdomen than normal for the pregnancy as a result of the uterine fibroids, depending on, again, their location, right? Another factor is the fibroids may obstruct allowing a normal vaginal delivery, again, because of their location. So sometimes patients may be required to have cesarean delivery because of the fibroids.
Okay, so it's really uncomfortable for the woman who is actually pregnant.
Yes.
Okay, yeah. So I know you mentioned earlier that it's important to engage in making good health choices concerning your reproductive health. You mentioned about attending a yearly Well Women's Clinic. So upon discovering that you've had a fibroid, depending on its size, it's important that there is follow-up, because if the fibroid reaches a stage where it can lead to these complications, I know you mentioned infertility as one of them, knowing the option is very important so that you can make wise choices concerning your health. So that is, it's important to know. So yearly visit is important. So my final question to you is, Can fibroids turn into cancer?
Very good question. I went to mention that earlier and I said I would not, but thank you for asking that question. So it is something that can happen, unfortunately, in about less than 1% of patients with fibroids. So yes, that is why the Food and Drug Administration in the US has discontinued recommending the use of what we call morcellation for the uterine fibroids. So previously, persons that had fibroids would have a laparoscopic surgery. So you're having minimally invasive surgery, but again, as I said, these fibroids can be big, and in order to get them out, previously what surgeons would do was they would morcellate them, kind of make them very small, and then be able to take them out. Now, because of that small risk of sometimes these actually being a cancer that can then now seed as a result of the process of morcellating them within the patient's abdomen, the Food and Drug Administration has discontinued or does not recommend that procedure to be done. If it is that the surgery is being done laparoscopically, surgeons now will do the morcellation in a bag. So it's in a closed container or closed area that it's not being spread throughout the patient's abdomen. But yes, it is like a less than 1% risk of it being a malignancy.
Okay, thank
but
you.
Again, let me just qualify that as well by saying that if a woman has fibroids and she is seeing a physician, the physician over time would know that if this is growing very rapidly, that is not normal. And so would probably not, if it's just a general gynecologist, would probably recommend that this patient be seen by a gynecologic oncologist to have the surgery performed, because again, like I said, having a rapid growth is not a normal pattern for just general uterine fibroids, okay? So if it's growing rapidly, that's not normal. They would likely send you on to a subspecialist at that point.
Okay. And what I find is that it is very important that as women, we are very knowledgeable about our bodies, so that, for example, worsening symptoms like increasing pain, you've been taking pain medication and it's not helping, right? Also, if the bleeding is getting heavier each cycle, that's a warning sign to seek medical attention. It could be that it's changing, right? It's changing in the situation.
Or your abdomen is increasing rapidly. That's also something to be concerned about.
Yes. So I mentioned that my final question to you was asking about cancer, but I actually have another one.
That's fine.
Yes. So I'd like to find out, so you've had the diagnosis of uterine fibers. What are some lifestyle changes that a woman can engage in to, ensure better, a better, I would say, to promote health rather concerning uterine fibroids, or help promoting activities?
So there is really generally nothing that we would say recommend. I know there's been a lot of stuff within the media, social media, particularly looking at the effect of PERM and uterine fibroids in Afro-Caribbean and African-American women. Is there truly a linkage between persons using PERM products on their hair as opposed to just keeping their hair natural? Not really sure, but if a female decides to do that as some sort of alternative, that's fine. Obviously, if you're somebody that, as a result of the fibroids, have anemia, then yes, eating foods that are rich in iron would be a plus for you to make sure that you're keeping your hemoglobin level as high as possible during this time. And generally, overall well health, right? Making sure that you're exercising, drinking lots of water. Those are things that would also help you in the long run, no matter what you decide to do. So if you decide that you want medical management, then, just take whatever medications have been discussed between yourself and your physician and make sure that you are being as active as possible during this time. If it is that surgery is an option, then again, you want to be as optimally fit as possible so that after the surgery, your recovery is much faster.
Okay, thank you for that. You mentioned, exercise, and I get to understand that obesity is also a risk factor for uterine fibroids. So if it can lead to it, it's important that, we engage in regular activities, right, to maybe can minimize the progression of the condition. So
Indeed.
yes. So do you have any parting words to anyone who may be struggling with the decision to seek medical attention concerning uterine fibroids?
So I would say seek medical attention, okay? If you suspect that you have uterine fibroids, especially if your mother, your aunt has suffered from the condition, then yes, I would say it's a great chance that you also have uterine fibroids. Seek medical attention. If the physician is not representing what you would like in terms of your options for further management, seek a second opinion, okay? You are your biggest advocate. You have to speak for yourself and advocate for yourself as well. Yes, the physician has a great wealth of knowledge, but at the same time, it is your body. And I think you should also be very much so involved in what is being done to your body at this point. So as long as it is not that there is concern that this may be a malignancy and you don't want to have surgery, then I would say go ahead and seek a second opinion to probably get something else to offer to you at this time.
Yes. And ongoing follow-up is important. Knowing that you have a fibroid, it's good that you follow up because they can get worse, right?
Yes. They can get bigger, you can have more. So, you may find that when you first go, there's only 2 or 3, and then you go back and they're like, oh, there's like about 6 or 7. And that can happen after time. And also, we didn't talk about the different surgical options, right? But in women that want future fertility and decide with their provider that they want what we call a myomectomy, which is where we just take out the fibroids but leave the uterus. The thing to remember is that doing a myomectomy does not remove every fibroid, okay? Because some of them sometimes are very small and you cannot remove every one, having to maintain the integrity and the structure of the uterus. So you are likely over several years to develop new fibroids as well. Okay. So you will have a myomectomy and you go back to your physician in 5 or 6 years and you're like, but I thought you took them out. And he or she did take them out, but there are new ones now, or there are fibroids that were there that they were not able to remove. And so those have increased in size. So if it is that you want the myomectomy because you want children, then as soon as possible, then you need to consider starting to try and, start your family.
Okay, it is very important to know. Yes, as you mentioned, some person may think that a myomectomy cures the condition. So thank you for that information.
You're welcome.
Well, Doc, this has been wonderful. I thank you so much for taking the time out again to, support this worthy cause. Thank you.
Thank you too. And thank you for what you're doing, bringing awareness to medical conditions affecting females. So thank you so much.
Okay, thanks.